Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information for the Amarillo community. We do these every Wednesday at 11 a.m. Let me go ahead and briefly introduce who is on our panel today. We'll let the panel, each member of the panel, make a statement, and then we'll take questions from our media. We are joined today by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Emmentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll go ahead and start with Amarillo Mayor Ginger Nelson. Mayor Nelson, how are you this morning?
I am well, Dave. Thank you. Thank all of you for joining us just to stay on top of what's happening in our city on the COVID front. And today we're here to bring you facts. I trust these doctors that are on the call. And I am thank the medical community in their jobs, but the fact that they take time out to be on this call to give you direct information from our hospitals. So thank you, because those facts about Amarillo and the Panhandle hospitals are very important, and we're getting them direct from the source, from the doctors that are at those positions. And I would encourage you as a citizen to also check with doctors that you trust in the community, aside from these folks that are on the call with us today, because that's a great way to get the facts, or to ask the doctors who are treating those patients in our community. What are we hearing out of Austin? Well, I have not spoken to the governor, but I know that he is watching our numbers. And I know that yesterday we hit day 3 of over 15% in our RAC hospitalization rate. And if you don't understand all of that I just said, the most important thing to take away from it is when we get to 7 days, the governor will analyze whether or not we need to make changes in our community. Changes such as pushing our businesses back down in capacity, changes such as limiting non-emergency surgeries in our community. The changes will be in the governor's control, not in our local control. So they will be judging out of Austin what we need here in Amarillo. And I think that bothers all of us. So in a moment, we're going to talk about where we do have control and the things that we can do to control what's happening here in Amarillo. The trickle-down effect is very real, and I want to talk about that for a moment. I was visiting this morning with a lady who is having surgery tomorrow in Amarillo. It's a cancer surgery, and she believes that if we were under this potential restriction from the governor on non-emergency surgeries, her surgery would possibly be delayed, and it might cause her to miss this narrow window she has of radiation treatment. And anyway, she had some anxiety about her situation. And even though she's not a COVID patient, it's affecting her and the possibility of how she would have access to her treatment. And I tell that story because this is not just about COVID patients. This is about all of us who might have a medical emergency, who might be doing treatment of some kind that's on a certain time schedule, and you need this treatment. If our hospital is full, if we go to restrictions on different types of surgeries, it might be you, it might be your loved one. So I'm laying that out there for all of us to consider, because we have to connect those situations to the choices that we're making every day. What do we as citizens need to do to take care of our hospitals, our hospital staff, and to take care of our city? Well, we have to increase our COVID awareness. We have to increase the choices we're making about COVID. We have to wear a mask more often. There'll be that time you think, oh, I forgot it. I'm just going to run into the store. I won't be in there long. We need you to turn around, go back to your car, get your mask, and then go do your shopping. Washing your hands. Maybe you were really good at first about washing your hands every time you went outdoors, you touched things. Please get very good again about washing your hands. Staying 6 feet apart as our kids have gone back to school and we think, well, they're together all day. Maybe I shouldn't really be conscious of that anymore. No, now is a time that's very important for you to be conscious of how close you're standing to people, whether you're in line at a store or whether you're at work and you're transacting business with people. Now is a time for us to increase our awareness on these things and do an even better job of them. not for yourself, but for others. And that protects our city, it protects our medical staff, and it keeps our hospitals open. The other thing that I think we need to do is to decrease our social calendars. There are some things that we're going out as citizens and doing, and I know why we're doing them, because we love each other and we love being together. But if we're going to increase our COVID consciousness and our COVID choices, it ties with decreasing our social calendars. Not forever, not even for a long period of time if we can get our numbers to turn around quickly, but it is important. Baby showers, birthday parties, even if you go to a youth sporting event and the stadium's not marked off 6 feet, you need to choose to mark it off 6 feet. Those little choices are going to connect to the people that need care in our community. And if we're doing the small things over here every single day, then when they need care, the hospital staff and the hospital capacity will be care of them. So you do increase our effort, implement the COVID changes that we've all learned to do in the last 6 or 7 months, and to decrease our social calendars while our city is at level red. That's all I have today, Dave.
Thank you, Mayor. Let's now go to Casey Stelton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm well, Dave. Thank you. I'm glad to be here to talk to our community this morning. We'll go through the numbers and then just have a couple of other items to talk about this morning. So as of yesterday, there were a total of 11,874 cases of COVID-19 in our community. 7,342 cases in Potter County and 4,532 cases in Randall County. We have a total of 7,838 recoveries, and we're really glad about each and every recovery. And we are up to 149 deaths in our community, and we are sad about each and every death, and we're sorry if that has affected your family. That leaves us with 3,887 active cases here in our community. Each of the cases do represent a unique individual. The total rolling 7-day positivity average for Potter and Randall counties is 27%, and the positivity rate at the public health drive-through testing site is at 41%. So almost half of the people who are coming through the drive-through testing site are testing positive. The 5-day positive case average is, we have every day we're averaging 227 new cases of COVID-19 per day over the last 5 days. The public health drive-through testing site does remain operational, and you can call 378-6300 to be screened and directed to the drive-through testing site. Today, we're at 1 week at our level red status. Conditions do remain consistent with that level red, and because we do have at least 2 metrics that are consistent with the level red. We will evaluate consistently throughout the next week as whether or not to reissue a new level red next week, or if we will move to level orange, depending on our metrics. GA32's hospitalization rate for the 25-county Panhandle RAC region, like Mayor Nelson said, we're at 3 consecutive days at over 15%. Sunday, we were at 15.9%. Monday, we were at 15.65%. And yesterday, which was Tuesday, we were at 16.5% for our 25-county area hospitalization percentages. Since October 1st, we have had 36 individuals in our community die because of COVID-19. 24% of the deaths related to COVID have occurred since October 1st. That is a very significant statistic, and one that we can make a difference in our community if we consider those prevention efforts and really work hard to wear our masks when we're around other people and socially distance when we're in groups. Our first case was 7 months ago, and in the past 20 days, we have seen more deaths and almost as many cases as in any other month since March. Since October 1st, we've had 22% of the cases, again, in the last 20 days. I'm pleading with our community to take this serious, to consider those prevention efforts and to stay strong in those prevention efforts. If you're a leader, a business owner, a pastor, a parent, please take those prevention efforts seriously to protect those in your care. The flu shots, masking, 6 feet of distance, staying home when you're sick, allowing employees who have been exposed to stay home throughout their quarantine time are so very important. Saturday is October 24th, and that celebrates World Polio Day, which I think should give us hope, should give us a target. We have eradicated polio from our nation and our world, and so I think through our efforts of social distancing and masking, especially once we have a COVID vaccine, I think we're all excited about that COVID vaccine. I hope that in 70 years we'll have a World COVID Day celebrating our success over this COVID pandemic. But right now is certainly the time to stay strong and to think about those families who have lost loved ones over the last 7 months. So I encourage us all to wear our masks. That's all I have today, Dave.
Thank you, Casey. Now I'll go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you?
Fine, thank you, Dave. The numbers today are sobering and reflect ongoing community-wide transmission that strains our hospitals alarmingly. Now, the public health prevention strategies that we talk about here week to week of wearing a mask, practicing social distancing, avoiding crowds, outdoor activities are better than indoor activities, washing your hands and staying at home in your own room if you're sick should continue to be practiced. And really, this should be viewed as the vehicle of how we get through this surge that's going to be present here for the next several weeks until we get a vaccine. Dr. Weiss and Dr. Lamentier, I think, need to have a significant period of time to talk about the specifics of what's going on at their hospitals. And I'm going to turn it over to them at this time, David. Thank you.
Thank you, Dr. Milton. We'll now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas. Dr. Weiss, how are you?
Good morning, Dave. Well, Dave, I am exceedingly anxious right now. I watched Casey's report yesterday at the City Council. I just heard her report now. I think we all have a lot of reason to be very anxious. When I talk to my patients, I hear them expressing just a multitude of emotions right now. They say they're anxious, they're depressed. Many of them are lonely or feel isolated, they're frustrated, and certainly they're all tired. But when you talk about the anxiety they feel, what they keep saying is they're anxious that we are not taking this as a community as seriously as we should. And we know that the end game is herd immunity, meaning that we have to have a high percentage of the population who are resistant to the virus. There's only 2 ways to get there. One is to have a bunch of people get infected and become immune that way, or hopefully to have a mass immunization plan and policy that will do that for us. Problem is, if we get a bunch of people infected, we cannot all get sick at the same time, because as we've talked about, we will overload our resources. For example, what have we had to do at Northwest over the last couple of days? For one thing, is our MICU has been full of COVID patients for about the last 2 weeks. We do not have a bed to spare. We've had to add a second ICU of COVID to add 10 beds to our ICU to be able to take care of those COVID patients. Well, the other thing we had to do is we had to physically divide our pediatrics ward now and make it half adults. So a non-COVID adult ward, so we can take one of our adult wards and make that an entire COVID unit now. So we're using our internal surge plan to try to keep people in this hospital, in this facility, but we're having to add more and more units to take care of these patients who are infected with COVID. Now, I think the thing is for the most part, we've had some employees here who have moved from Dallas and San Antonio, and they say that it appears that the people in Dallas and San Antonio are make it more of their routine to wear their masks when they're out in public than we do in West Texas. Now, clearly we have the luxury of space in West Texas, but when we do congregate in shopping centers, places like that, we have to do what the mayor's talked about, what Dr. Milton has talked about, is we've got to protect each other. Texans have got to take care of each other. The only way we're going to relieve the anxiety that we're all feeling is by preventing each other from getting this virus. So let's talk about the numbers we have in Northwest. So we have 76 positive patients today. The highest number we've had is 81, which is about a week ago, but we're staying in the mid to high 70s the entire time. Right now, we have 26 patients in the intensive care unit, including 2 children. Right now we're using 9 ventilators for the COVID patients, and we're using a total of 17 of our 40 ventilators at the present time. Now, if we do the calculation that the governor's asked us to do, which is what is our percent positive COVIDs over total licensed beds, today we're at 15.4%. However, if we take the beds that we know that cannot be used for COVID, like our 106 behavioral health beds, if I calculate the percent positive over our acute beds, we're at 31% today. Okay? We know that some of our sister facilities in South Texas got up to 50% COVID patients as of about a month or 2 ago. Now, the biggest thing is and Casey talked about this, is the outpatient testing. Yesterday, we tested 204 people, and 45 of those were positive. That was a 22% positivity rate. Midsummer, we were seeing it always less than 10%. So this positivity rate seen in the outpatient testing will translate into more hospitalizations and more demand on both BSA and Northwest for hospital beds. The other concern is we now have 80 staff members who are quarantined because of either exposure or positive. Yesterday alone, we had 7 staff members test positive for COVID-19. That's a big concern because as we gain patients and we lose staff, that is a bad combination. Now, I want to personally thank PJ Lemons and the Regional Advisory Council, the RAC, for helping us get more staff in. And really the leadership of the RAC have been many of the unsung heroes during this whole time in terms of supporting the hospitals with both equipment and staff. So they've done a phenomenal job for us. In regard to remdesivir, we have enough to treat about another 32 patients. Right now, we have 22 patients actively receiving remdesivir, and we treat a total of about 215. Now, and Dr. Lamentier and I were talking before this. We've noted that, thankfully, even though we have very high numbers of patients in the hospital with COVID, thankfully, we have less on ventilators than we did 6 months ago. And I do believe that the combination of Decadron and remdesivir, that both hospitals are intervening very early on in these patients, is making a difference in keeping them off the ventilator and therefore keeping them off a bad prognosis that they get put on a ventilator. I want to refer to what the mayor was saying. And Casey, we're on day number 3 of over 15% COVID positive hospitalizations in our trauma area. Okay, day number 7 means we have to make changes. Okay, one of the things is the governor said if we hit day number 8 at this, we have to stop doing elective procedures. That's a big deal, as the mayor pointed out. Okay, that we are still trying to catch up from the elective procedures we had to cancel 5 months ago. Okay, so these are people who need surgeries. They may not be emergent. Okay, but these are people who need surgeries for joint replacements and other things that they've been waiting for a long time. We will have to shut down elective procedures under the governor's order if we hit day number 8 over 15%. We'll also have to maintain at least 10% of our beds available for COVID-19 patients. So that puts some big barriers and big burdens on the hospitals if we hit that number. My fear is we're not doing anything in the community right now to change getting there in the next 4 days. Okay, so I'm going to make the same desperate appeal as Casey and the mayor do, which is if we want to basically reduce the anxiety in our community, we want to prevent elective procedures being canceled, and we want to protect all the small businesses that serve our community, we have to do what my distinguished colleagues here have said for the last 6 months, do all those things to prevent this virus from spreading in this community. So please, I appeal to you. I know our hospitals are right now in a lot of strain, right? And we will continue to serve this community, but it's got to be everyone's role to make this change. So that's all I have. Thank you.
Thank you, Dr. Weiss. Now I'll go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you today?
I'm good, David. Thank you. I think Dr. Weiss really hit on a lot of key points. I'm going to emphasize a couple of things as well and kind of give you the stats here at BSA. But before I start, I want to change gears a little bit and say, I want to thank our BSA intensive care nurses and our med-surg nurses that have been taking care of COVID patients now for 7 months. This is a very tiresome job. They're having to do things that they haven't done before in terms of the garb, the PPE, the protective measures that have to be put in place every time they walk onto that unit, they walk into those rooms, they are in close contact with patients. It is physically and mentally exhausting. They've been doing it for, in a non-resting fashion for 7 months, if you will, working extra shifts, working on days off. So thank you very much from the bottom of our heart at BSA. You're doing an outstanding job, and we couldn't do it without you. The news today, as stated, is sobering. We are just about at 100 patients in the hospital with confirmed COVID, 98 to start the day today. When I looked at our stats and talked with our nursing leaders, we had 3 more patients in the ER that were waiting to be admitted, that were likely going to need admission, I should say, and were positive, already confirmed. So again, this is another new record. I think the past couple of weeks we've come on, we've talked about hitting new records in terms of volume. The volume of patients that we're admitting at BSA with COVID positivity. 35 of those patients out of the 98 are in the ICU. That has caused us to have, as mentioned, as you can imagine, an extension out of our primary COVID unit, which was our medical intensive care unit, into our coronary care unit and into our surgical intensive care unit. It also has required us to expand our intermediate care unit. And in doing so, having to deal with that delicate balance of which patients are able to be in that step down intermediate unit and which patients need to stay in the highest level of acute care, which is the critical care unit. And those are not easy decisions. It becomes a triaging scenario that, again, we don't have the luxury of being more conservative with folks and saying, we're going to keep this patient in the ICU longer because, again, we don't have that ability to do so. We have to put the sickest patients in those beds, and that tends to be the ones that are requiring mechanical ventilation. That tends to be the ones that are requiring extensive blood pressure supporting drugs and other scenarios where they may have instability that leads to them needing that intensive monitoring. So as you can imagine, this is not the ideal scenario when we talk about how the hospitals are taxed in terms of our ability to manage patients. The 14 patients on the ventilator here is a portion of all on the vent. We have 24 total patients on the vent. Some of those obviously are non-COVID. So right now we're using 60% of our ventilator capacity. We're also using about 45% of our high flow nasal cannula oxygen capacity, which are different setups that we use in an attempt to try to stave off the ventilator, which we feel has been a key piece for us managing COVID patients and preventing an even higher utilization rate on the mechanical vents. In addition, we also started today with essentially a 98% capacity, 98% occupancy of our ICU beds. And that is only because of our very aggressive and appropriate care by our intensivists, by our hospitalists, by our Texas Tech physicians who are managing these patients and deciding when they can leave the ICU and doing so appropriately. Again, that delicate balance. Our staffing is challenged dramatically. Again, I would thank the RAC here wholeheartedly. PJ Lemons has been working with our nursing leaders, and we today, at this point, have had 30 RAC nurses come to our aid. We've also had 6 respiratory therapists from the RAC. We have a request in for more RAC nurses because we're not going to be able to keep up with the pace of this growing COVID census, in addition to our non-COVID census that is demanding those services. We have to utilize a lower nursing to patient ratio to manage our COVID patients. They're that intensive because of the time spent in those rooms, the need to again, put appropriate PPE on. It takes more time to manage patients that have COVID. And therefore the ratios need to be lower, and therefore it takes more nurses. When that is being said, we also have 106 staff on quarantine right now. Of those 106, 44 of those are nurses. That's a significant portion that we've had to pull out of that population for a transient period in order to manage the volume of patients that we have. These are not inflated numbers. These are the facts in terms of what's happening at BSA. And I think you heard the same things coming out of Dr. Weiss in terms of what our concern is. And regardless of where that exposure occurs, whether it's in the community or in the hospital, the majority of that has been in the community, as we have said. When we have someone who is exposed or infected, we have to take them out of the workforce. And that's the reality of the situation. If we look at our capacity numbers per the governor's revised calculation, we're at 22% today. That is the number of COVID positive patients over licensed beds. What's that percentage? If we do it based on the number of current patients in the facility at 98 out of our 318, then we're looking at a 31% of our inpatient population is secondary to COVID admissions. So a third of our inpatients are secondary to COVID. And again, it's not that you have COVID and it's a secondary issue. And the main reason you're here is because you're diabetes. The patients that are here with COVID are here primarily for COVID. And I think there's also some confusion nationally in the media about patients that are dying of COVID. And it's not really COVID, it's their coronary disease or it's their diabetes that cause death. That is a misnomer. If you come into the hospital and you have COPD and diabetes and you have a heart attack and you died of a heart attack. If you come in the hospital with COVID-19 and you happen to have diabetes and obesity, you died of COVID-19, not of diabetes and obesity. So again, it's critical to understand that these diseases are all serious, but COVID-19 is taking a significant impact on our community. I think that you should also know that we have, as of 2 weeks ago, we started looking at our elective surgery schedule. And we've been working with surgeons to move surgeries back that can be moved back in anticipation of the original calculation that was going to put us into lockdown. So we've been very fortunate that our surgeons have been fantastic in terms of working with us, making determinations themselves about their patient populations to say, this case needs to wait or this case can't wait. And, you know, if we look at the types of cases that have been traditionally termed elective with quotations, some of these are cancer surgeries, are vascular surgeries. And although they're not emergent where the patient has to go today, you can imagine that we don't want to put off any cancer surgery. We don't want to put off any vascular surgery that can go now otherwise because of the potential morbidity and risk for those patients. So again, we just got to be careful about understanding the black and white nature of the verbiage that we're using when we say elective and not elective. And again, Dr. Weiss and I have been talking about this, and he's saying the exact same thing as I'm saying, is that we have to work with our medical staffs to make those determinations that are not going to be easy decisions when it comes to pushing things back, which we don't want to do. Normal operations for the hospitals allows us to manage people that have both medical and surgical problems that really need to be treated as urgently as possible. So again, I think the last thing I'll say again is that I thank everybody on the panel. I think our community has done a great job in terms of communicating what our concerns are. We appreciate the support from the RAC. We appreciate the support from the local government. We absolutely need to abide by the masking and social distancing recommendations. It's the best thing we can do. And fortunately, I think we're going to have a vaccine at some point, but that's probably not going to be in the immediate future. When it does come, we will be aggressive about scrutinizing the safety and efficacy and getting it to our healthcare workers and those most in need first. So thank you for that time today.
Thank you, Dr. Lementier. Now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Thank you, Dave. First of all, I just wanted to say good morning to everyone and just echo on what everyone has said concerning what we can do to help prevent the spread of COVID. The social distancing, the wearing the mask, the hand hygiene. I think every person on the panel has echoed that, and I just want to keep reiterating it because of how critical it is to our facilities now that are being having to surge and respond to the increased COVID patients requiring hospitalization. So as we've seen the community numbers spread, we have also seen our numbers increase here. At Amarillo, since the beginning of the pandemic, we have had 228 veterans that we have tested come up positive for COVID-19. Now, great to hear that 86 have recovered, but if you do that quick math, you can see we still have over half, almost 2/3 of them are currently active cases. We have 17 currently hospitalized in our hospital, 6 of which are in our ICU. And then we have 125 that are able to self-quarantine at home, and we can continue to monitor them there. So I want to echo out to our staff too, whether it be the nurses, our pharmacists. This week is National Pharmacy Week, our infection prevention, because it's also International Infection Prevention Week. We have staff all coming up and taking this on to treat our veterans and working tirelessly to include when we've been able to flex some from one area to another to assist. Just want to mention tomorrow we are going to be having our first ever women's veteran town hall, telephone town hall. One of the things we see our women veteran population growing, and just think that this is a time to listen to them and how can we help make sure that we are responding to their needs in this very unique population. In an effort to improve the social distancing, I want to just remind veterans what I said last week is the VA has introduced the I Am Here abilities where you can text to 53079 from a cell phone that we have in our system. Just say the word here, and then it will register you as here for your appointment. And then you can wait in your vehicle, and then you'll get a text message back to give you, when we are ready to receive you. So that way we're not having to crowd our waiting areas. And with that, I just want to echo again an appreciation to our entire staff, the nurses, the ER, who have just worked to really respond and make sure we're doing the best to take care of our veterans. And I just want to appreciate BSA and Northwest for what they've done when we've had to transfer patients due to our being full, that they have been able to accept some of our veterans to take care of. And so with that, thank you for your time, and thank you for the opportunity to talk to my fellow veterans.
Thank you, Dr. Gonzalez. Now I'll go to City Manager Jared Miller. Mr. Miller, how are you this morning?
I'm good. Thanks, Dave. I'm going to be very brief. I just want to remind everyone, if you have symptoms you think might be coronavirus COVID-19, please call the public health hotline at 378-6300, and you'll be screened for the drive-through testing center, which is still open. If you are referred to the drive-through testing center and you do not have transportation, or you would like to use an alternate form of transportation, Amarillo City Transit is here to help. If you're referred for a screening for a test, please call Amarillo City Transit at 378-3095 to arrange free transportation to that test. I want to remind everyone that we are still under the Governor's Executive Order GA-29, which directs every person to wear a face covering over the nose when they're inside a commercial entity or when they're outside in public. So that's really important for everyone to remember. It's very germane and exactly relevant to what all of our different medical professionals have had to say today. So GA-29 is still in effect. With regard to GA-32, which is our current order that governs most of what we do here in town, we have 3 different occupancy levels to be concerned with. One is 50%, 75%, and 100%. So I'm going to start at the bottom. At 50%, we have all indoor and outdoor professional, collegiate, and similar sporting events, including rodeos, equestrian events. All of those shall remain to 50% of normal operating limits. In addition to that is bars. Bars are allowed to open at 50% while we are not an area of high hospitalization. As long as we are not an area of high hospitalization, every business in Texas can operate at no more than 70%, 75% unless it's otherwise listed. So the 50% category was an otherwise listed category. So all of our businesses right now are allowed to be, that are not in that 50%, are allowed to be up to 75%. And then there are businesses that are allowed to be open up to 100%. And those are primarily essential critical infrastructure, religious services, local government operations, child care services, youth camps, and a number of other less used functions. Now, in the 75% category, if we become an area of high hospitalization, which means we go 7 consecutive days at our hospitalization rate being in excess of 15%, which we are trending toward, then all of our 75% businesses will revert down to 50%, will not be, and that should happen or could happen if we stay on our trend as of Sunday morning. For the last 7 days, we have trended from 12.49% 1 week ago to 16.47% yesterday. That's a very consistent increase in hospitalization rates, and that's echoed by what all of our medical professionals have had to say. If that stays true and we do not have an interruption of that 7 consecutive days, we will go over 7 days effective Sunday morning. That's all I have, Dave.
Thank you, Jared. Now I'll go to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you today? Good morning, Kevin. If this is Kevin Welch, News Channel 10, are you there? We will come back to Mr. Welch here in just a second. Let's go ahead and go to David Gay of the Amarillo Globe News. David, how are you?
I'm good. Can y'all hear me?
Yes, we can.
Perfect, perfect. So I guess my first question is, if the city does hit that 7-day threshold above 15%, will there be any sort of announcement from the city? Will there be a news conference that day, kind of announcing that the measures that will have to be taken Sunday morning?
I doubt that we would have a news conference to announce that. We have talked about it frequently. We have laid out the procedures that happen if we do become an area of high hospitalization. We will certainly put it out on all of our social media outlets, but I do not anticipate, but if it's necessary, we obviously would. Mayor?
Agreed. I don't have anything to add.
Okay, fantastic. Thank you for the clarification. And I guess with the for BSA, I know you had talked a little bit about expanding the COVID-19 patients into different wards. As Dr. Weiss talked about, have you guys had to expand into pediatric wards as well for COVID-19 patients, as Dr. Weiss was speaking about at Northwest?
No, we have not had to expand into our pediatric ward. That would not be our plan here based on what we've laid out with surge planning for the past 6 months. We would continue to move into some of our tower med surge beds that are currently non-COVID and attempt to convert those beds if absolutely necessary. So we would try to keep the pediatric patients on that separate ward.
Absolutely, absolutely. I think that's all the questions I have. Thank you guys so much and have a great rest of your week.
Thank you, David. Let's now go to, if I'm not mistaken, Morgan Durden of KVI Channel 7. Morgan, how are you today?
Hi, good. Thank you. Good morning. I just have one question. And with the hospitalization rate being back around that 15% with the new formula, I just was wondering how good of a representation is that new number for the stress level of the hospitals?
Maureen, I'll answer that first. As I kind of argued last week, it's not a good reflection because, again, total licensed beds includes, I can speak to Northwest, includes 106 behavioral health beds at the pavilion. Those can't be used for COVID. It includes 32 neonatal intensive care units. So those are for newborn infants. Those can't be used as COVID patients or wards. It also includes adult acute rehab. We also have labor and delivery. There's 44 beds in labor and delivery for obviously expecting mothers who are laboring. Those can't be used. So there's that whole population of beds that really cannot be used to help us with this surge. And yet we were asked to include that in the denominator of this calculation. I think, based on what Dr. Lamentier did, we say, no, let's actually calculate the acute care beds that can be utilized. And that's much more reflective. And that's where obviously both us and BSA are at 31% right now with that calculation.
Yeah, I would agree that the licensed bed number is problematic for the reasons that Dr. Weiss outlined. Some of those beds are not beds that would be typically utilized. A licensure definition is a bit different in terms of how those beds get that status. And the issue really is staffing. I mean, we have physical beds, but a physical bed is worthless if we don't have the staff to take care of a patient in it. And again, that's why it's important that the resources coming from the RAC, which has expanded our employed workforce, is so critical and has allowed us to move forward. And I guess the other thing I would say is that 318 patients today, some of our highest numbers in a non-COVID environment would be in the 330 to 350 range with acute patients, which is a very high census, which taxes us in terms of staffing, obviously, and capacity. At 318, even if we were able to take more COVID patients, we still have to take care of non-COVID patients. So we have to have an increasing or an expanding number of staffed beds that we can manage these patients in. So there's no question that right now we are taxed significantly, a third of our patients being COVID. And again, folks, we are not in flu season yet.
Thank you. That was all I had.
Thank you, Morgan. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
Are we seeing any resurgence in the number of cases in the nursing homes around the area?
We do have some cases in nursing homes. Anytime you have groups, especially like congregate living settings, that's certainly a higher risk. And so, yes, we do have some cases in nursing homes currently.
All righty, thank you. And are we seeing an increase in the number of businesses being reported to the city for not requiring masks and not abiding by the occupancy limitations?
We've received calls throughout the last 7 months, but we're not seeing a higher incident of calls at this time relative to any other time. We're still looking into all those and still communicating with those businesses.
Alrighty, and if you get one reported and you do find that the allegations are true, what are the consequences for those businesses right now?
Well, as yet, we haven't issued any citations based on the governor's coronavirus orders. We have worked with those businesses. They've been extremely responsive and positive, so I anticipate that going forward.
Alrighty, and are we seeing more incidences of first responders being exposed or testing positive?
We've had a number of positives in our first responders. They're typically, what we've seen so far is they're not work-based. It's like the medical director said with their nursing staffs, it's local transmission through things you do when you're not at work. And we've seen a lot of that. We have also seen certain units go to training. They're doing a good job of wearing their masks. When they're eating lunch, they're not. And there is some transmission in situations like that. But it hasn't been any situations that have reduced or have compromised our ability to provide public safety. We have, in other words, brought in other officers or firefighters from overtime. We haven't had to turn off any fire stations or anything like that.
All righty, thank you. And for the hospitals, have y'all reached a point yet where you are having to try to find other places for local patients for care, just because you're so limited on beds and staffing and stuff like that?
So I'll answer that first for Northwest. So we have not had to send patients out. Now, what we've had to do is somewhat restrict the patients we bring in from regional facilities. So that, so yes, in that sense, we've had to tell some facilities right now we just don't have the capacity to accommodate the patient you're asking us to receive from your facility. And then, as we talked about, the internal surge plans, speaking like our pediatrics ward, where thankfully the way the hospital is designed, we can physically separate that ward into two separate wards and keep the adults on one side through one access and the children on the other through another access, so they don't cross over. But we're having to be quite imaginative in many ways in the hospital as to how we can rearrange some of our physical plant here to accommodate this increased number of COVID patients, yet keep everyone safe.
Yeah, that's correct. Same here. We have not had to send patients out to alternate facilities. but we have had to divert some patients away that are requesting to come to BSA because of a lack of bed availability, patients waiting in the ER for beds, and just not an ability to accommodate those transfers in certain situations, depending upon that day.
And then, as I've mentioned at the VA earlier, is we have had to send patients out due to our capacity. However, we've been able to find somewhere where most often BSA in Northwest, and they've been very responsive. But we've also sent to other regional facilities.
Alrighty, and one last question. With the state resources sent in by Governor Abbott, has that allowed us to do more contact tracing and seeing where some of these exposures are happening?
No, those resources were sent to the hospitals to directly care for patients.
Alrighty, thank
So
you.
we do have, I'm sorry, but we do, yeah, go ahead.
I just want to clarify that it's the health department that does the contact investigation. So I think you know that, but I just want to make sure that Aaron gets that into his answer.
Right. So the health department does the contact tracing. The hospitals obviously care for the patients. And so those resources that have been requested through the RAC have gone to the hospitals to care directly for patients. We do have resources and have hired temporary staffing to help at the health department, which would be separate than these resources that have been requested through the RAC.
Alrighty, thank you very much.
Thank you, Aaron. We'll come back one more time to, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, are you there?
I'm here. I think I overcame the computer finally.
It happens. How are you, Kevin?
I'm good, thanks. Dr. Milton, backing up a little bit, earlier you said the surge that's going to be with us for the next several weeks. Can you elaborate on that a little bit?
I think that most public health experts nationally and internationally feel that this wave is probably something that's going to be with us for the next 6 to 12 weeks. Now, I also want to say something else about that. I think we have the ability to bend that curve by practicing the things that we keep repeating here on the air. So in summary, yes, I think there's good reason to believe that this is going to be with us for weeks to come.
Okay.
Can I add something?
Yeah, go.
I think that in those places where we know we can bend the curve, we've seen 4 places consistently where people have been exposed. So before and after shifts, during break times, and during lunch time, like shared meals. So those would be the places that we really need to be very, very thoughtful about how far away we are from other people, if we're wearing our masks. So if you are a business owner, if you're a parent, if you're a pastor, if you're a leader of a group, be really thoughtful about those times. Again, before and after shifts, break times, and lunch times, like shared meals. Because those are the 4 times that we really see lots of exposure and lots of transmission. So I would encourage our community, especially during those 4 times in our day, to be really thoughtful about who we're around and what our activities are.
Okay.
Thanks, Kevin, for letting me butt in there.
Yeah, no, I'm sorry. I didn't mean to step on you. No, Casey, your department has had to go from contact tracing hundreds to thousands. Can you talk a little bit more about how you've had to adjust? Because I personally know some people who haven't gotten their initial contact for 8 or 9 days.
Yes, so we are working on, so notification through the drive-through. Again, people have access to their test results through the portal, and then we are certainly prioritizing those test results and those notifications We're also prioritizing school notifications or contact investigations, certain people, elderly people, people in nursing homes, those types of contact investigations. We are relying on physicians. So if someone is tested at an outside clinic, then we have sent through health advisories information to physicians that they can give to their patients, like what if I test positive, those kind of handouts, so that they can hand those to their patients so that they know exactly what the expectation is from public health. But yes, we have really seen an increase, like you said, from hundreds to now thousands of contact investigations, and so our staff are working through those in a prioritized fashion. We're not able to keep up with the current load with our staffing. We are also working on a method so that we can get through more, so that we can email forms out to people and they can click on a link and fill out their contact investigation. So hopefully we'll roll that out this week. So we are working on ways that we can introduce technology into this. And so we will certainly rely on our community to help us with that information. And then if you've been in contact with someone that's positive, the right thing to do is to 15 days from the last time you've seen that person.
Okay, thank you. Also, I know we traveled this road early on, but can you go back over what the definition of recovery is that shows up on the scorecard?
Yes, so recovery, if someone is positive and we're able to monitor that person, then recovery is 10 days from the date of their test result, and they have to be they have to be fever-free and symptom recovery for at least 24 hours. And then if we don't make contact with that person, and we try several times, sometimes people just don't answer our calls. So we try at least 3 times to call someone, and then generally we'll send a letter as well. But if that person doesn't answer, or if there's a population such as the prison that we don't have information on, then after 4 weeks, we automatically include those people in the recovery line if we have not been notified of a death.
Okay, thanks. And I guess for the 2 medical directors, can you tell me a little bit about how you're utilizing the surge resources? Because the governor's office was saying they're sending like 170 people, but I think Dr. Lamentier, you said 30 plus at BSA. So where did these people end up?
The 30 rack nurses that we have, we're using them in the units that have the greatest demand, which is on our COVID units, and some of our non-COVID units, in our ER, so ICU, med-surg beds, ER, if needed in certain procedural areas. Some of it obviously depends upon where that rack nurse is trained to work as well. And we're relying on our nursing leadership to make those decisions about where to best utilize them. But these are folks going right to the bedside.
Yeah, it's the same in Northwest. We're using those mostly in our COVID units, but also some of the non-COVID units. But I would say too that the RAC also oversees the Lubbock area, and those hospitals there are just as dire straits as we are. So I know a number of those staff members were sent to Lubbock to help support those hospitals there.
So Dr. Weiss, about how many are at Northwest?
I try to remember in terms of our initial count, we had, I could get that for you. I'm not sure how many we have at this point. We've also received some respiratory therapists also, but I know certainly just about every one of our units has multiple RAC nurses on them at the current time.
Okay, should I call Martha Del Toro to get a number?
Sure,
Okay.
she definitely help, yes.
Okay, that's it, thanks.
Thank you, Kevin. That was all the questions we had for our media today. This concludes our weekly news conference for the latest in COVID-19 information for the Amarillo community. I want to thank all of our panel members who took the time out to participate today.